Welcome, everyone, to our first episode of Advocacy in Action. This is the newest series of conversation taking listeners behind the scenes of campaigns that save lives. I am Min El Turkey with the Global Health Advocacy Incubator, and I'll be your host. Today and in future episodes, we'll sit down with public health advocates working across a diverse set of issues. We'll talk to campaigners working to turn the tide against the global pandemic, a mounting NCD burden, and other ongoing and emerging public health concerns. We'll get to hear insights and best practices from advocates working tirelessly to generate political will to create safer streets, prevent epidemics, increase health budgets, and spur national collaboration to help people lead their healthiest lives. We'll even break down the way advocates are expanding and mobilizing coalitions, changing media narratives, and applying public and private pressure to lawmakers in service of public health. So we hope you'll join us as we explore what's working, what's not, and what's coming next for global health advocacy. This brings me to today's episode, where we'll hear from Lucy Martinez Sullivan about what she's learned from a career spent advocating for policies that support new moms and babies, as well as wider nutrition efforts for organizations like Feed the Truth and the Clinton Initiative 1000 Days. Lucy started the newest phase of her career this month as the Senior Vice President with the Global Health Advocacy Incubator. She's now leading our organization as we work with advocates in more than a dozen countries to strengthen public health policies. Today, Lucy will be interviewed by my colleague, Jen Patterson, who joined the incubator just last year as the communications director, after leading communications campaigns on several issues, including the global refugee crisis through the U.S. Association of the UN Refugee Agency. Jen and Lucy, thank you so much for being here. Jen, over to you.
Thanks, Mana, and thanks to everyone tuning in. I'm thrilled to be speaking with Lucy Martinez Sullivan this morning to learn more about her experiences leading global advocacy efforts, her thoughts on the power of advocacy, and a little bit more about what she's looking forward to with her new role at GHAI. So welcome, Lucy.
It's great to be here. Thanks so much, and welcome everybody to this conversation.
So first things first, can you talk a little bit about what drew you to GHAI and what you're most excited about for this new role?
Absolutely. Yeah, it is such a privilege to be leading the Global Health Advocacy Incubator and join an organization with such an amazing track record of success. I think one of the things that drew me to the incubator was this idea of taking on some of the toughest fights in public health and doing so in a way that supports advocates who are both the closest to the problem and the solution. So I knew of the Global Health Advocacy Incubator because of its incredible work on food policy and to support advocacy in country on high impact policy measures such as taxes on sugar sweetened beverages and junk food marketing restrictions, et cetera. Just in terms of the success of some of the work, I've been so impressed with what the incubator has helped catalyze in Colombia with its support of advocates there who won a hard-fought victory last year when the government approved the Ley de Comida Chatarra, which is a junk food law, which regulates ultra-processed food and drinks by requiring front pack labeling for products that are high in sugar and sodium and fat. And it's so interesting because the GHAI was supporting advocates through a multi-year advocacy campaign where Colombia partners in Colombia, such as FIAN Colombia, de Justicia, Red Papas, massive industry opposition. So when you talk about taking on the toughest fights, going up against the very powerful food industry, and in Colombia's case, also a very industry sympathetic and conservative government. So I'm excited about the potential for victories like the one we saw in Colombia, victories that are increasingly necessary given the rising tide of obesity and heart disease and other diet-related diseases. But at the end of the day, the thing that I think is most compelling about the incubator's work is the impact that it has in terms of saving lives and improving health. One of the programs that I've been just so impressed with is the work that the incubator has done on drowning prevention, particularly in Vietnam and in Bangladesh. I learned that drowning is the leading cause of death among children under 15, and of course these deaths are completely preventable. And so the work that Global Health Advocacy Incubator has done to support capacity building with local partners, really partnering with the government to make drowning prevention a priority, and developing a national drowning prevention program is really remarkable. And so the program has had success in terms of children being able to swim, and I think also just in terms of government ownership and the political will that has been built up in Vietnam to the point where you have ministers talking about how they're measuring success in children's lives saved today and the ability to continue to protect children's lives into the future. And so I think that really speaks to the power of the incubator's work, and I look forward to to leading the team to do more of that terrific work.
That's great. Thank you, Lucy. And, I think one of the things you touched upon as you were talking about the work in Colombia, as well as the work in is really that power of partnerships. We have some incredible partners on the ground in country via government as well as civil society that are really doing amazing work and utilizing that power of advocacy to make real change that ultimately saves lives. I know, at least that I'm here, I've been so impressed with not only our colleagues, but the civil society partners that we work with to make sure that this happens. And, it isn't something that happens overnight. So these are people who are committed long-term to ultimately saving lives. It does speak to that power of advocacy. I'm sorry, go ahead.
No, please go ahead.
Okay. So you've also had an interesting career starting two new organizations, Feed the Truth and 1,000 Days. So it would be interesting to hear what are some of the best sort of lessons you have learned advocating for global health, food and nutrition policy that you will be applying to your work here at GHI.
Yeah, Jen, thanks for that question. And I was going to come in on your earlier point, which is, is so important that, advocacy certainly is a long game. And, there's a saying that luck is what happens when preparation meets opportunity. I would say that the policy wins is when preparation meets opportunity. And so the way that the incubator works in terms of supporting local partners in country to really develop a strategy and a set of campaigns and a set of approaches to build the support, the political support, in some cases the public support for policy change, is that sort of long game piece, which is so critical. Now, the advocacy, I think one of the things I've certainly learned in my career is that it requires years of sustained effort and investment, but it's also about recognizing and seizing political windows of opportunity to drive change.
Yeah.
And so being very attuned to what those windows of opportunity are. I think one of the other things I've learned is that advocacy is both an art and a science. And in terms of it being an art, it is about building relationships, building trust, motivating people, and helping people see themselves as part of the solution to a problem that needs to be addressed. The science piece, of course, comes in advocating for evidence-based policies at 1,000 Days. The whole concept started because of this paper that was written in the British medical journal, The Lancet, which identified this window of time in a person's life. They called it the -9 month to 24-month window. So from an advocacy perspective, that's not, that's a powerful, a piece of evidence, but it's not particularly saleable. So we kind of coined and popularized this term around the 1,000 days, the first 1,000 days of a child's life. And that's sort of, again, the art piece of it, but recognizing that advocacy requires a multidisciplinary approach, involving communications, legal, policy, media, political expertise. And I think that's one of the brilliant things about the Advocacy Incubator's work is it taking that interdisciplinary, multidisciplinary approach to the work that we do.
Yeah, absolutely. I mean, you can't do advocacy in a vacuum. You can't just have, one lane that's, trying to advocate for something. You have to attack it at all levels, from partnerships to, communications to media to political mapping, and really understanding who the players are and what the best route will be to advance the efforts. That's definitely true. How do you view the role of advocacy in advancing public health?
Yeah, I think there's probably three three things that I would highlight on that question. Number one, impact. Advocating for evidence-based policy is a means to achieve public health outcomes at scale, right? So population-wide change, the impacts of policy change are touch many people, and in some ways offer the biggest public health bang for the buck. So I think that's advocacy plays a critical role in pushing forward that kind of policy change. Advocacy is also important when it comes to accountability and ownership. Um, Advocacy can help shape how governments and other institutions prioritize and take ownership of policies and services that improve public health. It can help determine whether governments are providing adequate resources to meet the health needs of its people. And then, of course, advocacy is critical to holding governments and other powerful institutions accountable to people and accountable for health outcomes. And then I would say equity, the equity piece. There's been a lot of focus, rightfully so, on equity and the massive inequities we have throughout the world. Advocacy can help ensure that people who are marginalized, excluded, or who are most affected by a particular problem are at the table, whose interests are being served and whose voices are being heard. Deeply unequal systems, they don't change themselves. And so you really do need civil society movements, advocates to push from the outside to change those systems.
Yeah, that last piece is extremely important. I think, to address sort of that human and economic cost of preventable deaths, you really need to have a deep understanding, as well as people at the table who are part of that audience, to make sure that you're moving in the right direction.
Absolutely.
So what is a good example of the power of advocacy? We've been talking about, advocacy efforts and, as you've learned, but if you could talk a little bit about the power of advocacy, I think our listeners would be interested in that. I'm certainly interested in that.
Well, there are so many good examples out there. It's hard to pick just one, and I'm sure many of the listeners today have their own examples that they would highlight. I think one of the most interesting ones, and it's more recent, just in November of last year, Argentina actually passed one of the most strongest and most comprehensive food policy bills in the world, and it addresses an urgent issue because 80% of deaths in Argentina are caused by a chronic disease, mostly related to overweight and obesity. Mm-hmm. And so this law, it was the Health Food Promotion Law, enshrines these evidence-based food policies, including the front of package warning labels on junk food, marketing restrictions, regulation of school food environments, and food procurement. And it with overwhelming support, despite very strong opposition from the food and beverage industry. And it's interesting because the legislators in Argentina publicly acknowledged civil society's role in the law's passage. And they've been fighting for this package of policies for a number of years. So I think this really speaks to playing that long game, the power of locally led, locally owned advocacy. It was organizations in Argentina that were at the forefront. Global Health Advocacy Incubator came in at the tail end of the campaign to try to help ramp up the advocacy efforts ahead of some key votes. And this is an example, I think, where civil society, as I said, was recognized, but also contributes to this growing momentum across the globe on implementing these kinds of evidence-based policy measures. So, what's possible in Argentina, which, again, this one of the strongest, most comprehensive food policies, is now possible in so many other countries. And I think that really speaks to the power of groups, committed, dedicated people with support, fighting these good fights, and hopefully not only changing health outcomes for people in their countries, but potentially helping to change the world.
Yeah, absolutely. I think other countries will now really look to Argentina as an example for strong and comprehensive health food policies. So, the passage of this health food promotion law will, make a big will play a big role in improving public health, like you said, not only in Argentina but across the world, which is just incredible. It really shows that power of advocacy, not just in a local country or local community, but how that can spread worldwide.
Absolutely. And some of the advocacy work that happens also happens in some ways behind the scenes, maybe don't make the headlines. So one of the most interesting programs that we have at the Incubator is around civil registration and vital statistics, which basically means we help governments in countries strengthen their mechanisms to record births, deaths, life events, and that kind of advocacy work doesn't make headlines, but it's critically important to the foundation of public health to be able to have good data to understand what's happening in a country, with different populations, in order to better address some of the public health challenges and preventable causes of death.
You are so right that advocacy sometimes takes a long time and is in that background. It doesn't necessarily always get the splashy headline or be this huge victory that's in the that's celebrated publicly. But just as important are these pieces in the background such as the Data for Health program that strengthens those requirements in countries to make sure that things like death and birth and the data that's being collected help to ensure that people are basically receiving their basic human rights. So yeah, the civil registration program that GHI works with across dozens of countries is not one of those flashy ones, but it is just as important. You're right.
Yeah, and it's just so amazing to learn about the work of the Incubator and learn really the work of the partners that are working on the ground for for public health policy change. It's really the people at the end of the day that are fighting for change and for healthier future for children, families, people everywhere. And you said something about people having access to something that they are rightfully entitled to. So health as a human right, I think is underpins so much of what we all do, not just at the Incubator, but certainly all of us who care about public health.
Yeah, you're right. I mean, in this global community, even you can tell the passion behind the people and the partners that we work with, because in times of COVID, when everyone has had to pivot and change the way we're working, programs are still moving forward and wins are still happening and policy change is taking place and lives are ultimately being saved. So I think that really is a testament to the passion of advocates being able to figure out other ways to ensure that they're able to move forward and get things done.
Absolutely, and I just have such gratitude for everyone who has been working in this field and during these challenging times. So you're right. I think COVID has certainly exposed the importance of public health and in many cases how undervalued and underinvested in public health is. So I know we will be excited to help change some of that along with our partners.
Absolutely. So the last question I have for you is more about on the personal nature. How do you like to spend your free time?
Well, I'm a mom of two little girls, and I enjoy spending time with them. And I'm having to learn how to be a coach. So I have dabbled in coaching soccer and coaching basketball. It is completely out of my comfort zone, and it pushes me. But I'm lucky that I get to be able to spend as much time with them as I do. And other than that, I getting through this pandemic, everyone has had their coping strategies, and mine has been a lot of outdoor workouts, kind of boot camp type of things. So you'll find me on some mornings very early in the morning, doing burpees and push-ups. So.
Well, that's great. It has been very inspiring, and I've certainly learned so much more about you. So thank you so much for this discussion. Do you have anything further to add before we turn it back to Manna?
No, this has been great, and thank you everybody who joined in this Twitter Space conversation, and thank you, Jen and Manna.
Back to you, Manna.
Thank you, Jen, and thank you, Lucy, for taking the time to share your experiences and insights when it comes to advocacy. When I was listening to parts of the interview, really struck me. I loved the way you talked about advocacy as an art and a science. I think that was a beautiful way to describe our work and really captures the multidisciplinary nature of the work. And then secondly, when you touched upon the importance of advocacy when it comes to inequity, which I really believe is at the core of what advocates in all fields are working towards. So I know that we are all super excited to welcome Lucy to the Incubator and are so looking forward to where her leadership will take us next. I want to thank you to everyone tuning in to the first edition of Advocacy in Action. To follow the series and stay on top of the latest news from the Global Health Advocacy Incubator, please follow at Incubator GHAI on Twitter or connect with us on LinkedIn and sign up for our newsletter at advocacyincubator.org. Thanks, everyone.
Thanks, Anna.